Well, some concerning stats from nurses showing that a lot of them are at the end of their ropes. We learned this week almost 4,000 nurses quit their jobs in the public healthcare network. Now, in a regular year, that number would have been around 2,800. So that's 40% more than usual. A lot of them opting to practice in private agencies. Why is this shift happening? Let's get to Denyse Joseph, our next guest. She is VP of the FIQ. It's a union that represents Quebec healthcare workers. Denyse, thanks so much for coming on the show.
Thank you.
Tell me, Denyse, what right now, what is the typical life of a nurse in Quebec?
Well, the typical life of a nurse or healthcare professional, because we represent licensed practical nurses, respiratory therapists, and clinical perfusionists also. Well, day to day, they cannot give safe and quality care to their patients. And when day after day you feel that this pressure that you are pushed around without being able to respect your profession, respect your code of ethics, it's burning. You cannot continue like that. We have hit the wall, and this government will have to take a pause and reset the network right now. You know, it's one thing complaining about the fact that the previous government did this and did that, did not did this or that. Well, it's enough. There have been 2.5 years. They've been elected, this government, and it's time for them to really take seriously the situation where the healthcare professionals are at right now. And when you mention that 4,000 nurses have resigned in the past year, and it's a drastic increase, it's even more than that, because this data is calculated over not even all the healthcare network, because they only got the information for 20 out of 22 CIS or CIUS, but there's also, long-term care facilities. There's also the shoes that are not included in there. So there's even more than that. And this is not counting the drastic increase of our members that are now on long-term disability. So it means it's 2 years and over that they're being off sick or on working accidents. So we have an increase of 28% here compared to last year, the 2019 report. So it is terrible. And the government has not helped the situation. We understand a pandemic situation like we are right now it's a first, but coming with these ministerial decrees, sanctioning, all the collective agreement has been suspended, so that we have no more contract. Everyone is obliged to work full time. No one is allowed to have time off or vacation. Everyone is obliged to work overtime. Everyone has been displaced or almost, because we're closing an operating room. I'll give you an example. I've been a nurse for 30 years in an operating room, and tomorrow you're telling me, well, Denyse, you're going to be taking care of a lot of patients COVID-19 on this unit. I'm sorry, I need training. This is totally different than what I've been doing for the past 30 years. You're putting my patients at risk, and you're putting me at risk as a healthcare professional. So it's time for this government to wake up and, try to look at what can we do for the staff. There is no reason right now why we should keep the ministerial decree in place, because we have a drastic decrease of numbers of COVID-19 patients. So why do we still have these decrees in place? It has to stop. They need to look at the situation. They need to send a very positive message to these director of hospital that they need to look at the situation, and they need to healthcare professional.
Denyse, we're with Denyse Joseph, Vice President of the FIQ. It's a union that represents various groups of healthcare workers in Quebec. Denyse, based on what you just told me, based on the fact, I'm reading about nurses, for instance, being told 4 consecutive days, 16-hour shifts. Why is anyone sticking around this profession? Why are you sticking with it based on what you just told me about how tough it has been?
Because healthcare professional wants to care for their patients, and that's where they come and play with their feeling. Oh well, what about you? Think about your patients, think about your colleagues. But that's why we are seeing now so many leaving the profession. So many are, you work a certain time in the network, and then you're allowed to have your full pension. Well, there's so many of them now that are retiring without having the full benefits because they are just giving up. So many of them are just leaving the profession and changing completely career. We've seen nurses and licensed practical nurses getting hired at the Costco because the working conditions are much better there. They respect you. There's no respect for us right now, and that's why we're saying to the government, it's time to stop, put a reset on this. These employers need to be put back in the track where you have to be respectable and for your staff.
It sounds to me, Denyse, that, based on what you're saying, it sounds like the situation is going to get worse before it gets better. Do you think that's the case?
Well, I think it is, but what we're telling the government is it's a wake-up call. You have to wake up right now, and you have to act right now. Otherwise, it's going to be very, very difficult to bring back the network and to bring back healthcare professionals into this network. And just think about the ones that are in school right now. What is the message we're sending them? The government have to look at it. They really fail there, and if they're not acting right away, it's going to be terrible.
Denyse Joseph is VP of the FIQ. The FIC represents healthcare professionals in this province. Denyse, thank you so much for shedding light on this program. I appreciate it.
Thank you so much. Have a great day.
You too. Hearing that story of nurses, healthcare professionals leaving the system and going to work at Costco because at least there they believe they'll be treated with respect, that is frustrating.